Well, thank you all for staying. I know it's been kind of a long evening. Tonight, I will be speaking about the impact of physical activity on health and well-being. I'll be giving some general information and then speaking directly about a study that we've been working on here at the University of Colorado. I've been an athlete almost my entire life, starting with competitive swimming at the age of 7, switching over to triathlon, and now running. Physical activity is a huge part of my life. And with my background in public health, I just feel that I want to spread the word that physical activity needs to be an important part of everybody's life. Physical activity is a fairly generic term, referring to anything from walking the dog to taking the stairs, riding your bike around the block, or riding your bike across the United States. It really doesn't matter what form your physical activity takes. The most important thing is to just get out there and do something. Over the years, guidelines for how much physical activity people should get has changed. Right now, the Centers for Disease Control recommend that adolescents get 60 minutes or more per day of physical activity, and adults get 2.5 hours per week of moderate intensity exercise. It's about 22 minutes a day, plus 2 days of muscle strengthening. This isn't really that much when you consider the positive benefits, but really a lot of people are ignoring what's out there, and they like to make a joke of it. And the sad thing is, 33% of adults and 80% of adolescents do not meet the standard set out by the CDC. And even worse, 31% of people are totally inactive. They're not doing anything at all. Why do we care about this? Because people who are more physically active and more physically fit have reduced risk of things like heart disease, diabetes, cancer. They report better quality of life. They have lower rates of depression and drug use, and they have lower BMI. What the doctor in that slide was saying is no joke, because people who are physically inactive have a 52% higher risk of premature death, 39% higher risk of diabetes, and 26% higher risk of heart disease. These risks are not nominal. What about our great state of Colorado? Well, we do have the title of the thinnest state in the nation, and we like to talk about this every year when those reports come out. But sadly, our great state is becoming more obese, as we have increased in obesity from 1995 from 11% to most recently in 2011, where the latest data was taken from, to almost 19%. That's a huge increase. Adolescents, 7% obesity in Colorado. And inactivity in Colorado, 18% of adults and 11% of adolescents are totally inactive. And we take a look at this map here of the state of Colorado. You can see that on the red, the outside of the state, 25% of obesity. If you look at Boulder tucked in there, 16% obesity. And if you were to overlay a map of physical inactivity, it would match these rates of obesity, so that the regions that have 25% obesity are also about 25% inactive. Boulder, 16% inactive. And you can look in some of these ski towns, have the lowest rates of inactivity in Colorado and the lowest rates of obesity. So we have a study here in Colorado, the Center for Anti-Drug Use and Dependence. And in this study, we actually have measures of physical activity and some very important outcomes like general health and well-being, drug use, et cetera. And we want to look at whether there are clinical relationships between level of physical activity and these outcomes. And the nice thing about this study is that we have these measurements in these people when they were adolescents from the age of 12 to 18, and we measured them again when they were young adults from the age of 19 to 25. So we're able to look at these in 2 time points and see what these associations are. If the kids who are more physically active in adolescence, how does that carry over to when they're young adults? Is there a long-term effect? So we have just under 2,000 subjects. For some reason, we couldn't find one more subject to meet our criteria and make that a nice even 2,000. 51% are male. And as I said, we measured them twice. And our outcomes are BMI, drug use, general health, and then we have measures of well-being such as depression, neuroticism, and I would say that most people would think neuroticism is not a good thing. You know, no one ever said, hey, you're really neurotic, and took that as a compliment. And extroversion, more outgoing. You know, people who are more outgoing are generally more well-liked, and that's seen as a more positive attribute. So first, let's take a look at just the measure of how many minutes per day people are exercising in this group. So if we look at the female adolescents, they exercise 79 minutes per day. And as they age to young adults, they went to 50 minutes per day. And the males are exercising more, 99 minutes per day in adolescence and 72 minutes per day as young adults. And what we're seeing here is very common across national and international samples, that males exercise more per day than females, and that there is a drop in how much people are exercising as they get older. So this is commonly seen. And you look at this slide and you think, wow, this group is fantastic. They're meeting all the criteria. They are so healthy. But unfortunately, when you just look at the average, it doesn't tell the whole picture. Because in this group, 42% of females did not meet the CDC criteria, and 30% of the males didn't when they were adolescents. So that mean over there was driven by what we call these high-activity people. And so if we really look more carefully at activity, and we take the low-activity people, the bottom 25th percentile, and we compare them to the high-activity people, the top 75th percentile, we can see a lot of differences. Number one, these low-activity people, wow, they are really low. Females and adolescents, 11 minutes per day. And they drop to 6 minutes per day when they get older. But we look at this high group, 162 minutes per day in adolescence, in young adulthood, and they drop to 114 minutes. So even the high activity group is getting lower. And we see the same thing for males. Low activity group, 24 minutes per day. They drop to 9 minutes, so neither group is meeting the CDC criteria. In this high group, 187 minutes per day and dropping to 152 minutes. So that mean is really being driven by this high group. And what we can do then is look at the high activity group and compare them to the low activity group and look at these various outcomes and see what the effects are. Well, let's look at obesity. I separated out the males and females in this slide because there are some differences here. And if you look at the low activity group in adolescents, wow, the BMI there is not so good. The BMI in the low activity group higher than the high activity group. And not only that, when they reach young adulthood, their level of obesity is going up to over 18%. That's pretty bad. The high activity group, their level of obesity, 5%. Let's look at the males. Well, overall, their level of obesity is lower than the females, showing that for females, being inactive is a real detriment. And again, though, it's higher in the low activity group than the high activity group. So clearly, there's an effect for people who were not active in adolescence. Their BMI is going up when they get older. What about smoking? Well, I combined males and females in this slide because the trends were the same for both. And again, you can see this big disparity in the low activity group and the high activity group on the number of days in the past 6 months that they smoked cigarettes. So in the low activity group, they're hovering around 90 days in the last 6 months. And the low activity group here, much lower. So again, people that were more physically active in adolescence had lower rates of cigarette use than in the low activity group. And that carried over to young adulthood. So there was a protective effect there over time. What about these measures of health and well-being that we talked about? Well, people who are more physically active reported better general health, 18 to 21% better general health. And we have a range there because there were some differences in males and females. But across the board, in adolescence and young adulthood, people who are physically active, they had better health. What about depression? Well, people who are physically active reported fewer depressive symptoms, 10 to 14% fewer depressive symptoms than the low activity group. What about neuroticism? Well, there was quite a difference in that group, 20 to 25% fewer symptoms of neuroticism in the group that was physically active. Extroversion, again, we're seeing that people who are physically active, more extroverted. So these measures here of health and well-being were much better in the group that was high in physical activity. So what does this all mean? Well, adolescent physical activity clearly had an impact on general health, psychosocial measures, and drug use. Adolescent physical activity, those people that we saw on that slide where I separated out between the high and the low physical activity, well, the people that were low in physical activity in adolescence tended to be low in physical activity when they were in young adulthood. So whatever group people started off in, that is the group they finished in. Meaning that people did not go from low activity in adolescence and all of a sudden decide, oh my gosh, I have been missing out, I need to switch over to that high activity group. That just didn't happen, they just stayed where they were. So adolescent physical activity was directly related to physical activity in young adulthood. And then I didn't show any slides there, but there's also this relationship from young adulthood physical activity to these measures. So it's all very interrelated, but all starting with physical activity and adolescence. Well, we see that there are benefits of physical activity in adolescence, and those levels are seen all the way through to young adulthood. But the problem is people's levels of physical activity are dropping as they get older, and we're seeing now that adolescents are just inactive. They aren't even starting activity. So what do we do about that? This is what we are challenged with. This is just a huge problem that we are confronted with. Levels of obesity are going up, levels of physical activity are going down. How can we make this better? Well, on Sunday, I ran the LA Marathon. About 2 hours after I finished, I drove home, and we happened to be along the course, and we were at mile 18. That meant 2 hours after I was finished, these people were still 8 miles from the finish. And you see who these people are? These are kids. And they are part of a program called Students Run LA, 3,000 strong. And they were out there running the LA Marathon. And this is what we need to do. We need to challenge kids, give them something to believe in, give them something to boost their self-esteem, do it as a group. They're all wearing matching shirts. They're all excited. They're all into it. Truly inspiring. More programs like this need to crop up around the country to get these kids involved. Because once they start activity, we know that they stay there. And after, can you imagine, these kids went back to school Monday morning and said, I ran the marathon yesterday. So a new study that we're doing is going to be looking at physical activity in triathletes. And we're hoping to get measures of physical activity in a wider age group and hopefully look at this in a more longitudinal fashion than just a 5-year spread. And we'd also love to get measures of blood markers so that we can look at things like metabolic syndrome and cholesterol in some very physically fit people. And that's all. Thank you.